Hello everyone, welcome to Study Ayurveda. Today we are going to study about Shwetra kushta, the Ayurvedic concept of vitiligo. Let us have a small introduction regarding the introduction of Shwetra. Shwetra, it is also known as vitiligo, and it is a common problem associated with an intense social stigma in Indian society. The disease is more than a simple cosmetic problem. The skin is one of the essential sense organ. As the skin covers the whole body, pitta should be maintained in a proper state and it needs continuous care. An imbalance in vata and brajaka pitta may cause skin diseases. Shwetra is just not a disease of today's era. So let us have a look at the nirukti of Shwetra. The word Shwetra has its root in the Sanskrit, that is Shweta, which is known as white patches. So there is a different opinion regarding the Acharya Kashyapa and Sushruta Samhita. He tells about that Shweta Bhava Michanti Shwitram. This means the reflection of white color is known as Shwetra according to Kashyapa. So Sushruta called the disease as a kilasa instead of Shwetra. So it is very important to remember in the AIPAGT point of view. Tvagatam evam aparisravi means there is only involvement of skin. Aparisravi here is it is non-exudative. So what is the Nidana? What are the causative factors which are responsible for the manifestation of this disease Shwetra are, according to Charaka, Viruddhahara Sevana and Papakarma. Next, we are dividing the Nidana into Aharaja, Viharaja Nidana. So in case of Aharaja Nidana, let's see the Ati Sevana of these all things are responsible for the manifestation. So it is not necessary that it will leads to the manifestation of kushta or shwetra, but excessive consumption of these food articles may leads to the production of shwetra. It is important to be remembered in the mind. The increased frequency of diet, increased consumption of amla, lavana, katu and kshara rasas. Guru Sniktahara Kshira Payasa. Here Guru Sniktahara and Kshira Payasa, they are heavy in nature. So because of its heaviness, it does not undergo easy digestion. That just because they are not undergoing easy digestion, they are obstructing the srotas and adhere at the lines of the srotas, and it is responsible for the improper supplement of the nutrients to the other parts of the body, and it is hampering the Uttarottara Dhatu Poshana. Because of their long standing nature, it produces ama. That ama itself is a cause for many diseases. So that we have to remember. Dhanya, Nishpava, Hayanaka, Uddhalaka, Koradusha, Kulatya, Masha, Tila, Sarshapa. These are also the heavy in nature. The properties of these drugs are also they are Guru, Snigdha and Abhishandi. That we have to remember. Matsya, Mahisha, Gavya, Varaha, Madhu, Fanita, Guda, Siddha Dravyas. So Madhu or Fanita or any sweet items, and also intake of fish. It is also important. Intake of beef meat, it is also important. So have the habit of intaking of pork also. So in those patients, in those persons, we are seeing many of the patients are having the complaints of this. So first and foremost step in the treatment of this shwetra, we are advising the patient to not eat the non-veg food materials. So they are heavy and they are responsible for most of the conditions. They are responsible for production of these diseases. So we are advising the patient not to follow the non-vegetarian food items, especially the meat as well as the fish, the meat of pork, beef, etc., etc. We are not advising them. Also, we are not advising the curd for the patient. We are not advising the honey. We are not advising guda, that is jaggery and its preparations. We are not advising them, and sweet food items are also avoided. Frequent consumption of such food or food habits leads to the formation of improperly metabolized substance and toxins. That is nothing but the ama. So mithyahara, how we can understand this mithyahara? The food which is not taken according to the Astavida Vishesha Ayatana. Ashtavidhi Visheshayatana is very important. Here, the 8 rules and regulations which are explained by Acharya Charaka and Vimanasthana to know that the person how the food should be and what must be the quantity of food, how the patient should take the food, all the regulations has been explained, so one has to follow them. So in Mityahara, Ajina Bhojana is the person is having severe indigestion. He is not having the he is not having the feeling of taking the food. So in that condition also the patient takes the food. Adheshana, excessive intake of food without getting hunger, he or she takes the food. Atyasana, Atyasana here is mainly they are having their sedentary lifestyle, eating and sleeping, eating and sleeping, eating and sleeping. That is also cause for the many of the diseases. Excessive use of madhu, matsya, mulaka, lakucha. So we have seen about the madhu and matsya, but mulaka here is a radish, should not be taken, and lakucha it is a kind of a fruit, so that is also very important and it is heavy for digestion, so it should not, it is also completely avoided. During ajirna, they are telling it as during ajirna, but we are advising the patient completely to avoid the madhu, matsya, mulaka and lakucha during ajirna also, and in normal conditions also we are advising, because we are advising to avoid it, because the patient itself has a mandagni and ama is present in their body, but we can't able to suspect that where the vitiated doshas are there in the body, because it is a sarva shariragata roga. So for before taking any risk, we are advising the patient not to follow these type of food. Okay, next, this kind of meal interferes with the normal metabolism and leads to disease. Any meal with ahara like matsya and dadi sevana at just a single time may not cause the disease, but for disease manifestation, continuous consumption must be there. So here Viruddhahara concept is having very broad and elaborative explanation in this present era, because Viruddhahara is not about just the matsya and dadi. Here the different food combinations which are being used by the individual in this daily routine. Some people have the habit of intake of the paneer or the milk varieties of a food. Some people have the habit of taking momos. There might be a sweet as well as the bitter combination, sweet as well as astringent combination, sweet as well as pungent drugs combination. It is not advisable. And the food preparations which are made from maida flour, it is also not advised. And the food preparations which are from the masha, black gram, they are also heavy for digestion, they are also avoided here. And in case of viruddhahara, some patients have the habit, if they are feeling hungry they will drink the cold drinks, so it is also responsible for the decreasing of the agni. These are some of the points that should be remembered and should be avoided, that their lifestyle will be important here for the treating of any disease. Every doctor may prescribe you the medicines, but it depends on you how you follow. It is also important, and what the things you are taking inside and what are the things you are avoiding from yourself, that is important. If you are not avoiding any of these activities, any of these food items which is not good for your body, then it will leads to manifestation and aggravation of the presenting disease, and will leads to manifestation of the severe kind of disease, or it may lead to incurable conditions. So please try to avoid these kind of things. And some people is also having the habit of taking the meat along with the curd. They are preparing meat with the curd, and some people are adding milk into it. It is not advisable for anyone. Acharya Charaka has compared Viruddhahara with Visha, and has also emphasized that the disease originated by Amavisha are most incurable and difficult to treat. So any kind of ama which is present in the body can be digested by the langana or langanapachana or dosha vashishana. But if this ama is converted into ama visha and it is circulated all over the body, and it has got its sthana samshraya in the curve vaigunya srotas, then it is difficult to treat. Common viharaja nidhanam. Common viharaja nidhanas for the kushta are described like, because it is important to remember, and nowadays how you can consider this, it is also responsible. These are the things which are more responsible for the production of the kushta in nowadays people. First is that divaswapna. Divaswapna, most of the people is having the habit of late night sleep. So because of their late night sleep, they sleep in the afternoon or they sleep in the daytime. That is also one of the most reasons for the production of the disease, because divaswapna does the kapha and pitta prakopa. So this kapha and pitta prakopa in the daytime leads to the manifestation, and also divaswapna does the mandagni in a person. It also further does the ama, and in case of ratri jagarana, there will be an increased production of vata. So they here the three doshas are totally vitiated in this condition. So avoid divaswapna except in the summer season. Vega vidharana. Vega vidharana, a person is in urgent, has to go for a meeting, has to attend the meeting, has on conferences, etc., etc. In those people, they does not go for their natural urges in the proper time. One thing. Another thing is that they are waking up late in the morning. Because they are waking up late in the morning, their natural phenomena or natural physiology of their body is changed. Because you are waking up late in the morning, you are not getting urge for the defecation. So it is important to remember. So first is, if you are getting up early in the morning, you will get the natural urge for defecation. If you are not getting, go for the glass of lukewarm water and have it. After 5 to 10 minutes, you will get the defecation easily, and there is no constipation, there is no manifestation of any disease. Because of their lifestyle, they are developing these kinds of things. Atishrama here is doing the work which is beyond their capacity. The person has a certain capacity, so they are limiting their capacity and doing their work. It is also important. Santapa. Here I am trying to explain the word santapa. Here is that santapa, how I can explain the santapa here is mainly, let us take an example of a person who is working in a company from 9 to 5, and he is sitting in an air conditioner for this amount of time. Like, take an example of Bangalore, and afterwards he comes out, there will be warm and dusty environment and very increased temperature outside there. There will be a variation in the temperature here, because he is in air conditioner, he is in a room of air conditioner which is well protected. Immediately coming out from that environment to very hot environment, that is the most important cause. So you have to avoid that. Take as much as possible the natural light, natural air from the outside. So it is important. Avoid for staying for longer duration of time in the AC. It is also one of the important thing. So most of the patients which come to the hospital for the treatment of many skin diseases, they are having their habit of spending time in AC for longer duration of time. That is important. Vyayama. So excessive exercises are also avoided during this. And Vivaya, excessive indulgence in the sex. Divaswapna has been explained here earlier. Chikitsa Vaishamya. The person who is going for panchakarma procedures in improper manner, in rather taking any of the improper panchakarma procedures, we can take that vamana. Improper vamana is main cause for the manifestation of many diseases. If the proper expulsion of the kapha is not there, if the kapha is present inside the body, leads to the production of mandala, kota, kushta, etc. Manasika karana. So stress is also one of the most important feature here, because everyone from if we take the statistics of this, it will be from 18 years to almost 40 to 45 years generation is there, no, all of them are in stress. So stress is most common thing for a people to develop many of the skin diseases. So bhaya, shoka, krodha, chinta, etc. Maybe anything, but the it may be anything. The things which are bothering the mental status of a person, all these things like stress, anxiety, depression, etc., they leads to manifestation. The other causes which are less botherable but not the least, they are Kulaja Nidana, that is Bija. Maybe it is running from family to the family. It is hereditary in nature due to Papa Karma. Shwetra is considered as a Karmaja Vyadi. Vachansi, Atyayini and Kruratagna Bhava, Suranamanindhu and Guru Dharshana. So mainly Shwetra is caused by the imbalance of all the three doshas. Those are Vata, Pitta and Kapha. They are vitiating Rakta, Mamsa and Medas Dhatu. The Shwetra is classified into Daruna, Aruna, Kilasa. Daruna here the vitiated doshas, the Rakta Dhatu. When the doshas vitiates the Rakta Dhatu, the patches will be red in color. In Aruna, when the doshas vitiates the Mamsa Dhatu, the patches will be in coppery color, that is Tamra Varna. Kilasa, when the doshas vitiates the Medo Dhatu, the patches will be in white color. It is the most common clinical presentation of Shwetra, hence Leukoderma is often called as Kilasa. And as we have seen earlier, based on dosic predominance, they are having their different names like Dharuna, Aruna and Kilasa. Here Vata Raktagata is Aruna and Krishnavarna, Pitta Mamsagata is Tamravarna, Roma Shatana and Vidahyata is there. Because there is involvement of Pitta, it does the Roma Shatana and Vidahyata. Kapha Medogata is there, Shwetavarna, Bahushitam and Sakandu Balavan. So how it will be useful, because these lakshanas which will be explained by the patient in front of us will be useful for the Vyadi Vivachedana. Either there will be involvement of Vata is there or Pitta is there and Kapha is there. Based on the predominance of Vata, Pitta and Kapha, the choice of medicines and the choice of treatment changes. Many students who come to Ayurveda, initially they don't know how the pathology works. They ask, and some people who are not believing that much in Ayurveda, and those who don't want to know about Ayurveda, they say that, what is the pathology for that disease? How they are going to manifest? You don't have any pathology. So I said, yes, we have the pathology, and there will be a detailed explanation regarding the pathology for the manifestation of disease. Okay, let's see the Sampropti of Kushta, mainly specifically the Sampropti of the Shwetra Kushta. So the Nidana Sevanam, it causes due to the vitiated doshas spread from Koshta to the Shakha while traveling through all over the body. Wherever there is a Sthana Vaigunyata, wherever there is a Ka Vaigunyata, it gets lodges and shows the symptoms of the disease. So let's see some of the conditions or some of the external triggering points which makes the disease to spread from Koshta to the Shakha. That we have the Rudyat Vishandanat, Paka Sroto Mukha Vishodhanat. Paka Sroto Mukha Vishodhanat. Koshta Shakha Malayanti Vaiveshta Nigrahat. So these all are the things which are responsible for the vitiated doshas which gets triggered. These are the triggering factors which makes the doshas to spreads from Koshta to Shakha. While traveling through all the body, wherever there is a Sthana Vaigunyata, Ka Vaigunyata, here we can consider there is a Ka Vaigunyata, means in our body there are some areas or some space which are completely empty, or we can say which are weaker points of our body. Because these Ka Vaigunyata, there is a weaker points, or there may be certain under hidden pathology which is present inside. Because of that, because of its weakness, because of its pathology, or because it is not as that of normal healthy body cells of our body cells, okay, in that conditions it gets lodges and shows the symptoms of the diseases. Then the doshas move in Tirrikatsiras and get lodged in tamra layer of twacha causing sanga to the local rasava and raktava srotas. So among 7 layers of the skin, mainly the tamra layer is affected here, and it gets obstructs the localized or superficial rasavaha and raktava srotas mainly. And wherever there is a, as we can say here, wherever there is a sthana vaigunyata or kha vaigunyata, there will be a local rasava and raktava sangha. Okay, it leads to the impairment of, because there is a sangha, it leads to impairment of local brajaka pitta and causes the tvakshaitata. For further samprapti continues, and the deeper dhatus like mams and medas are involved and leads to the production of the disease. Involvement of each dhatu exhibits the specific discoloration on the lesion, as we have seen that Daruna, Aruna and Kilasa. Doshas which settles in the Rakta dhatu produces Aruna Varna. Those which are settled in the Mamsa dhatu produces Tamra Varna. Those Medu dhatu produces the Shweta Varna. Here mainly the affected Udana, Vyana and Brajaka Pitta, Udana Vayu, Vyana Vayu, Brajaka Pitta, Slekshmaka Kapha, which are responsible for the manifestation of the disease, and also the hereditary involvement of the disease is described by Acharya Sushruta. There is a manifestation of Bija. There will be a Bija Dushti. Purva Janmakrita Papa Karma and Papa Karma, which is related, which is done in the previous lifetime, or disobeying the god, disobeying the elders, disobeying the guru and teachers, etc. It is important here. And also called as ka vaigunyakaraka nidhanam, as a sparsha nendriya is adhisthana. How it will be ka vaigunyakaraka nidhanas, because the, as we can say that the cause for ka vaiguna is not there. Ka vaigunya here is the empty space in the body, or weak point or weak space or empty space in the body where the doshas goes and lodges there. So in for ka vaigunya comes under the samprapti. For ka vaigunya, purva janma krita papa karma is responsible. Okay. And Sharika doshas, Indriya and Mana are related each other, is stated to be under the control of Vata. Visheshan of Sharika doshas causes the Visheshan of Mansika dosha also. Visheshan of the Vata Pitta Kapha does the Visheshan of Raja Tama. Let's see about the Sadhya Sadhita of this Shwetra. Sadhya Lakshanas are only one dosha is there, then it will be Sadhya. The patches are not fused together. The hairs are of normal color. Then it should not be Rakta Varna Yukta, or it should not be Shukla Varna Yukta. And having short duration of pathogenesis means that it should not exceed the 1 year of duration. Involvement of Uttana Dhatus. Asadhya Lakshanas are involvement of Gambhira Dhatu. Mainly Gambhira Dhatus are Mamsa, Medas, Asti and Majja. But here the Rakta is commonest. Here Rakta is vitiated in the Shwetra because it is a skin conditions. In almost all the skin conditions, Rakta involvement is must and should. So after that, Mamsa, Meda and Asti Majja. Important. Agni Dagdam and manifested in Agni Dagdam, here the patches will look like the burnt scars, and the manifestation in the palms, soles, lips and genital organ. It is important here for us to remember that if it manifested in the palm, soles and lips and genital organs, it is asadhya or difficult to manage. Raktaloma, it has a red colored hairs. Chirakari, it is of long duration. Patches are fused in nature. And Janmataha, it is from born only. It is hereditary and it is transferred from the parents to the child.